Hello everyone. So today we begins with the topic of cardiac cycle, and it is one of the most important topic of the cardiovascular system. What is cardiac cycle? The cardiac events that occur from the beginning of one heartbeat to the beginning of the next heartbeat are called the cardiac cycle, or in some other words, cardiac events between two heartbeats are known as cardiac cycle. Cardiac cycle, there are two phases of cardiac cycle, atrial events and ventricular events, or there are two events of the cardiac cycle. One it is related to atria and another one it is related to ventricle. The total duration of one cardiac cycle it is 0.8 second. This 0.8 second divided into various atrial events and various ventricular events. Atrial events includes atrial systole of 0.1 second and atrial diastole of 0.7 second. In the ventricular events, ventricular systole having the 0.3 second and ventricular diastole is of the 0.5 second. So total of these atrial events and ventricular events is 0.8 second. Now I am going to represent events of the cardiac cycle in a diagrammatical manner. This is the most easiest diagram to understand the cardiac cycle and remember it. I prepared a rectangular box which is of the 0.8 second. So duration starting from this point to this point it is the 0.8 second. This upper part it is for the atrial events, the lower part it is for the ventricular events. In between the atria and ventricle there is a atrioventricular valve and here it is the semilunar valve. So here the atrial events includes the atrial systole which is of the 0.1 second and atrial diastole which is of the 0.7 second. And ventricular events which includes ventricular systole which is of the 0.3 second and ventricular diastole which is of the 0.5 second. Now the ventricular systole. It is of the 0.3 second. Starting from this point up to this point. It is of the 0.3 seconds of the ventricular systole, and the events of ventricular systole isometric contraction which is of the 0.05 second, rapid ejection phase 0.11 second and slow ejection phase 0.14 second. So this is the phase number 1 isometric contraction phase of the 0.05 second. This is the phase number 2 of the rapid ejection phase of the 0.11 second. This is the phase number 3 which is the slow ejection phase and it is of the 0.14 second. So this is the ventricular systole and total duration of ventricular systole it is of the 0.3 second and all three events occur during this 0.3 second event of the ventricular systole. Now ventricular diastole it is of the 0.5 second. In the ventricular diastole there are four events occurring. First isometric relaxation 0.1 second. Second event first rapid filling phase 0.1 second. Third event slow filling or diastasis 0.2 second. And fourth last rapid filling phase 0.1 second. So here it is the phase number 1 which is the isometric relaxation phase of the 0.1 second. This number 2 it is the first rapid filling phase of the 0.1 second. This number 3 it is the slow filling or diastasis phase which is the 0.2 second. And this last rapid filling phase which is coincide with the this atrial systole and it is of the 0.1 second. So this is the ventricular diastole and all these are the four phases of the ventricular diastole. The total duration of ventricular diastole it is of the 0.5 second. So first we begins with the ventricular systole which is of the 0.3 second, and inside the ventricular systole there are three events. So first it is the isometric contraction which is of the 0.05 second. Now here I am representing this one, it is the right side of the heart, and this one the lower one it is the left side of the heart. On the right side of the heart this is blue color which is due to the deoxygenated blood, and on the right side of the heart this reddish color which is due to the oxygenated blood. The anatomy of the right heart includes the right atria and right ventricle, and anatomy of the left side of the heart it includes left atria and left ventricle. There is a mitral valve which is present between left atria and left ventricle, and aortic valve which is present between left ventricle and aorta. Okay, so now the event of the isometric contraction which is of the 0.05 second. Whenever this isometric contraction phase begins, that means ventricular diastole has been completed and now ventricle enter into the phase of ventricular systole. Closure of atrioventricular valve and it produce first heart sound. Just beginning of this isometric contraction, there is a closure of atrioventricular valve, tricuspid valve on the right side and mitral valve on the left side. So here whatever the black color box you are seeing, this is the closure of the tricuspid valve and mitral valve, and it produces the first heart sound, which is due to the closure of these atrioventricular valves. And diastolic volume 110 to 120 ml. Whatever the blood is present inside this right ventricle and left ventricle, the end diastolic volume is same for both the ventricle, which is 110 to 120 ml. Now semilunar valve close, ventricle contract as a closed chamber. So here both the semilunar valve, pulmonary valve and aortic valve still closed and ventricle contract. So it is the phase of ventricular systole. So contraction is occurring and ventricle contract as a closed chamber. So that what will happen, the pressure increases inside the ventricle, left ventricular pressure more than 80 mmHg and right ventricular pressure more than 8 mmHg. So this left ventricular pressure more than 80 mmHg there will be increase, and in the right ventricular pressure there will be increase in the more than 8 mmHg. Once the pressure has been increased inside the closed chamber of the ventricles, then what will happen? There will be the opening of the semilunar valve. Pulmonary semilunar valves open and aortic semilunar valves open. And once the valve is open, the next step of the ventricular systole begins, which is of the rapid ejection phase. Here during this time of the ventricular systole, there is continuously atria in a atrial diastole phase. So continuously filling of the atria from the superior vena cava and inferior vena cava in case of right atrium and from the pulmonary vein in case of left atrium. There is a continuous filling of this atria during the atrial diastole phase. This phase of the 0.7 second and continuous atria of blood inside the right atria and left atria. Alright. Okay, now the events of the rapid ejection phase, which is of the 0.11 second. Atrioventricular valve still closed. So this is the tricuspid valve and here it is the mitral valve which is still closed. When the left ventricular pressure increase more than 80 mmHg, there is opening of the semilunar valve which is the aortic valve, and increase in the pressure rises up to 120 mmHg. So this left ventricular excessively contract so that the pressure rises up to 120 mmHg, which is the systolic blood pressure. And there will be the rapid ejection of blood from right ventricle into the pulmonary artery and left ventricle to the aorta. So here on the right side, once the pulmonary valve is open, the right ventricle will contract and blood enter into the pulmonary artery. And on the left side, when the left ventricle contract, the aortic valve will open and the blood enter into the aorta. Whatever the amount of the blood which is ejected from each ventricle during each heartbeat, it is known as stroke volume. And during the ventricular systole, whatever the amount of the blood which is ejected, out of all this, 2/3 volume of the blood is ejected during this rapid ejection phase of the 0.11 second. Now the next, it is the slow ejection phase which is of the 0.14 second, and it is the third phase of the ventricular systole. During this phase, atrioventricular valve still closed. So here the tricuspid valve is closed and mitral valve is closed. Semilunar valve still open. So here it is the pulmonary valve and aortic valve, both valves still open. So from right ventricle the blood enter into the pulmonary artery and from left ventricle the blood enter into the aorta. Still it is continuing. And 1/3 volume of the stroke volume is ejected. 2/3 volume of the stroke volume is ejected in the rapid ejection phase and remaining 1/3 volume of the stroke volume is ejected in the slow ejection phase. Now the end diastolic volume, which is the volume present inside the ventricle just before the ventricular systole begins, and it is of the 110 to 120 ml, and systolic volume which is of the 40 to 50 ml. That means end diastolic volume and end systolic volume. And whatever the difference between these two volume, it is the volume which is ejected out of each ventricle during each heartbeat or during each cardiac cycle, and it is around 70 ml. This 70 ml, it is known as stroke volume, most important. Now ejection fraction, also it is the most important. It is the fraction of the end diastolic volume that is ejected out. It is called ejection fraction. Out of this whole of the end diastolic volume, only 70 ml of the blood is ejected during rapid plus slow ejection phase. Not all the blood is ejected. The whatever the fraction of the blood which is ejected of the end diastolic volume, it is known as ejection fraction. The fraction of the end diastolic volume that is ejected out, it is called ejection fraction, and it is of the 60%. And here we complete the ventricular systole. After that, there will be the beginning of the ventricular diastole. Now begins with the ventricular diastole, which is of the 0.5 second. The first event of the ventricular diastole, it is the isometric relaxation phase, and it is of the 0.1 second. Now which are the events which occurring during this isometric relaxation phase? Atrioventricular valve still closed. So here it is the atrioventricular valve which is the tricuspid valve, and here it is the mitral valve which is still closed. Just at the beginning of this isometric relaxation phase of the ventricular diastole, there is a one phase of the 0.04 second which is known as protodiastole, and during this time there will be the closure of the semilunar valve, and this closure of the semilunar valve will produce the second heart sound. Atrioventricular valve is closed and semilunar valve is closed, both sides, right side of the heart and left side of the heart. So ventricle act as a closed chamber. Now this ventricle act as a closed chamber, and so that the ventricular pressure decreases from 80 mmHg to 2 to 3 mmHg. Remember, this is the phase of ventricular diastole. So ventricular becomes relaxing. So the pressure inside the ventricle become decreasing from 80 mmHg to 2 to 3 mmHg. And systolic volume which is the 40 to 50 ml, as I just told you in the previous slide. And systolic volume, that means here it is the systolic phase of the ventricle, and whatever the blood is ejected, it is the stroke volume, and out of the end diastolic volume minus this stroke volume is equal to end systolic volume which is of the 40 to 50 ml. When the ventricular pressure falls below the atrial pressure, the atrioventricular valves will open. I just told you at the beginning of these phases of the ventricular systole that this is the phase of atrial diastole, both on the right atria and on the left atria. So during this time, the blood is coming continuously inside the atria, and due to closure of this atrioventricular valve, the blood is accumulating inside the atria on the both left atria and right atria. In the right atria, the blood coming from superior vena cava and inferior vena cava, and on the left atria, the blood is coming from the pulmonary vein. Now when the ventricular pressure falls below the atrial pressure, the atrioventricular valves open. So continuously storage of the blood inside the right atria and left atria, when increases more than that of the ventricular pressure, these atrioventricular valves will open. Tricuspid valve will open and this mitral valve will open. Once the valve is open, there will be the entry of the second phase of the ventricular diastole. So here it is the second phase of the ventricular diastole, which is of the first rapid filling phase of the 0.1 second. During this phase, semilunar valve closed. So here the same semilunar valve on the right side pulmonary valve and on the left side aortic valve which are closed, and here the atrioventricular valves open. As I just told you at the end of step number 1 of the ventricular diastole, there is an opening of the atrioventricular valve, tricuspid valve and mitral valve, so that the right atrial blood enter into the right ventricle and left atrial blood enter into the left ventricle. Atrial blood enters ventricle rapidly, so it is the first rapid filling phase. Whatever the blood is accumulated during this period of time, it is all the blood enter into the ventricle at the same time. Hence it is rapid. That's why this phase it is known as first rapid filling phase, which is of the 0.1 second of the ventricular diastole. Now slow filling phase, which is also known as diastasis, and it is of the 0.2 second. Now in the slow filling phase, semilunar valve close. So there is closure of the semilunar valve. Atrioventricular valve still open, and venous retard from the superior vena cava and inferior vena cava directly enter ventricle via atria. So all the blood which is accumulated during this period of time enter into the ventricle during this rapid filling phase. Now whatever the blood which is coming from superior vena cava and inferior vena cava directly enter into the ventricle during this phase of the slow filling phase of the right side. And in the left atrium, the blood is coming from the pulmonary vein, and once the rapid filling phase of the ventricular diastole begins, all this stored blood enter into the ventricle very rapidly. Now in the slow filling phase, whatever the blood which is coming from pulmonary vein directly enter into the left ventricle. So here from both the phases of the ventricular diastole, which is the rapid filling phase and slow filling phase, around 75% of the blood enter into the ventricle, both right ventricle and left ventricle. And here it is the last phase of the ventricular diastole, which is the last rapid filling phase, which is with the atrial systole 0.1 second. So here it is the event of the atrial systole, which is of the 0.1 second, both right atria and left atria. Atrial systole, during this time the atria will contract, or which are the events are present inside this phase of the ventricular diastole. Semilunar valve closed, so this is the semilunar valve which is still closed. Atrioventricular valve still open. Right and left atria contract simultaneously, so both the right atria and left atria contract simultaneously, and it pumps remaining 25% of the blood into the ventricle. So whatever the blood is present inside the right atria and this left atria enter into the right ventricle and left ventricle respectively. Alright, and all these event comprises 100% of the blood, and this rapid filling phase and slow filling phase, during this both the events around 75% of the blood is enter into the ventricles, and remaining 25% of the blood enter into the ventricle during this last rapid filling phase along with the atrial systole. The atria will contract and the blood enter into the ventricle. Alright. So this is the last stage of the ventricular diastole, and after that immediately there is a beginning of the ventricular systole. So here there is no ending. Continuously there is a activity started of the ventricular systole. Clear? The thing which end over here starting from this side. Alright. Okay, now pressure changes during systole and diastole in the cardiac cycle. So this is atrial diastole and this is atrial systole. This is ventricular systole and ventricular diastole. During the right atrial diastole, the pressure is 0 mmHg almost, and during right atrial systole, the pressure is 5 to 6 mmHg. During right ventricular systole, the pressure is 25 mmHg. During right ventricular diastole, the pressure almost 0 mmHg. Pressure changes in the pulmonary artery or pulmonary trunk. During systolic phase, the pressure is 25 mmHg, and during diastolic phase, the pressure is 8 mmHg. Now during the left atrial diastole, the pressure almost 0 mmHg. During the left atrial systole, the pressure is around 7 to 8 mmHg. During the left ventricular systole, the pressure reaches to the 120 mmHg, and during the left ventricular diastole, the pressure almost 0 mmHg. Pressure changes in the aorta. During systole, the pressure reaches to 120 mmHg, and during diastole, the pressure maintained to 80 mmHg. So this is the pressure changes during systole and diastole in the cardiac cycle. So this is the cardiac cycle. There are two phases of the cardiac cycle: atrial events and ventricular events. Atrial systole, which is of the 0.1 second, atrial diastole, which is of the 0.7 second, ventricular systole, which is of the 0.3 second, and events isometric contraction 0.05 second, rapid ejection phase 0.11 second, slow ejection phase 0.14 second, ventricular diastole, which is of the 0.5 second, and during this time isometric relaxation phase, which is of the 0.1 second, first rapid filling phase, which is of the 0.1 second, slow filling phase or diastasis, which is of the 0.2 second, and last rapid filling phase, which is of the 0.1 second. So this is the summary of the cardiac cycle.